Red light is on? Good. So this is part 2. We just finished treating her. It's now about 30 minutes later, and the results are very encouraging. The pubic structure has much improved symmetry. I'm on the top of each pubic bone now, and I'm not finding there's the slightest step down now, but when I come and I put one finger on the left pubic bone and the other on top of the fibrocartilage, they're almost in the same plane. I know it might be difficult for you to see that, but I think the next piece you'll see to be very interesting. Now the pubic bones are closer together because this is all hard tissue. Okay? And
you can just turn it off.
Leave the filming. We'll continue to film while the cell phone gets shut off. Welcome to my world. But the pubic bones are much closer together now. And when I put my pinky finger in there and I'm pushing firmly, I'm pushing with 10 pounds, I'm loading it for 20 seconds. There's no movement. I'm against a hard piece. You can see that. The fibrocartilage of her pubic structure is no longer positioned posteriorly. Okay? Now, let's have you lie on your stomach, please. You'll recall that the sacrotuberous ligament was very hard, and I can now depress that. Okay, that's much more normative. And the ischia did not spring before, and now I can spring, put force through that, and I can see her heel bob when I do that. The sacrum was positionally posterior, in which the sacrum was more posterior in relationship to the PSIS. And now the sacrum is actually anterior to the PSIS. Okay, so the sacrum has come forward into her body. That blocked motion of her sacrum, but I can spring now, and the force goes through that structure, up the spine, and down into the lower extremities. And when I spring the sacrum, I can see her heels bob medially. So the movement goes through the SI into the hip joints. The L5 segment was not moving before, and so she was really beating up L4-5 joint, and now that has spring mobility. So I'm really pleased. I was somewhat fearful that we might find an unstable pubic joint, but in fact it is connected with deformable connective tissue, very strong tissue. So we used a small force for a very long time, a total of 20 minutes of a constant force to restore mobility and function in the structure. And before we stop filming, we won't get your face in this, we'll turn the camera, but would you just take a few steps and come back, and if you could just give us a little bit of feedback, is that possible?
Yes.
Okay, great. We'll just turn the camera. Okay. That's it, keep filming. And go ahead and get up and just move around. And you can come back. Any thoughts?
You know, my heels are actually touching even. I used to feel
more firm. Okay, a firmer heel strike. Okay.
Yes, on that.
Very good. Anything else?
That first touch. And this, I feel less crooked. That crooked feeling is for real. I mean, I wasn't making that up. I don't have that feeling.
Okay.
Of crookedness. Balance.
And I'm curious, just sit down. I don't know if you'll feel any different sitting or not, but let's find out.
Okay. Wow. Going up and down from the chair. I'm not having to play a balancing act
Uh-huh.
right now, which is pretty cool. You know, I'm usually subconsciously having to tell myself, okay, you're going down, you're going up, so concentrate. And right now, I'm just doing it without concentration.
Alrighty. Anything else before we wrap up? Or Dawn, any comments?
How does it feel on the?
On the ITs,
Yeah.
fine. I feel I feel like my IT, like the tuberosities down there on my gluteus is, they're even. They feel even, and that's, I swear they were not.
So before you felt like your sit bones were not even?
Yes.
Very good. Well, we'll stop filming here now.
Okay.
I'm pleased with what I see. I was concerned that we might find that you had an unstable pubic joint, but I don't think that's the case.
Yeah.
So we have 24 hours before you come back. We'll
Yes.
we'll see you 2 more days in a row, and we'll do a final take and see see your experience at that point.
Okay. This is great.
So thanks, appreciate it.
Thank you.